All right, well, good afternoon, everybody. My name is Rol Shukla. I'm an outreach coordinator at Crossroads for Hope, formerly known as Council for Community Central New Jersey. And Melissa, the floor is yours.
Thank you. Thank you. And hello, everyone. Good afternoon. I am so happy that you're here joining us for this series. It is our pleasure to serve the community, and we're happy to talk about health. And so thank you for participating in the pre-poll question. And as we go through this webinar, as we go through the information, if there's anything that comes to mind that you need, I don't want you to hesitate to put that in the question or the chat. It's good to share information. It's even better when we can take that information and apply it. And even better when we can help each other do that, whether it be through encouragement, support, or resources. So today we're going to talk about taking charge of your health and going back to basics. So I want to share with you, as Haral said, I'm Dr. Melissa Richardson, and I am an employee of RWJ Barnabas Health here at Somerset. And also the slides for this presentation are being shared by the MD Richardson group. But I have nothing else to disclose for this presentation. I don't receive anything. The only benefit I get is to share information and to partner with you in becoming healthier. And so our objectives for today, by the end of this presentation, I hope that you will be able to define health. And to be able to define health for yourself in your own terms and on your own terms, that you'll be able to state 3 basic needs for improved health, that you'll be able to identify barriers to achieving your health, and that you're able to identify 2 strategies to address the barriers to achieving health. So we've already done the poll questions, and so we'll go on. So what is back to basics? What does this mean? What is basics for us? It may vary from one person to another, but basic simply means forming a foundation. Like, where are we starting from? And for the purpose of this presentation, we are going to focus on health promotion and health prevention. That's going to be our starting point. I understand that we are in different phases of our health. We are dealing with different circumstances regarding our health. But for today's purpose, we are going to focus on health promotion and health prevention. And that's regardless if you are someone who maybe has diabetes, or someone who has been diagnosed with cancer, or someone who has hypertension. What is health for you? So when it comes to the Black and Brown community, there are many words that come to mind when we think of health. We think of barrier, we think of disparity, we think of injustice, we think of racial discrimination and inequity. We think of access, we think of quality. And today, when we talk about health, I want to frame it a little differently from us. Yes, we are dealing with these truths and we're dealing with these realities. But is there something that I can do? Is there something that you can do? Is there something that we can do to help change what we're experiencing when it comes to health? So we're going to have another poll question for you. Health is the absence of illness, and Haral's going to set up another poll question so that you can answer that. And I ask, if possible, if you can go ahead and answer that. And understand, there is no right or wrong answer. So we'll give you just a little bit to go ahead and answer that one question.
Yes, I'll share the results as soon as.
Thank you.
Just a couple more.
for you? A Lamborghini, a Bentley, a Mercedes, a BMW, or maybe something even more exotic. And it's time to fill that car up with gas. What kind of gas would you put in that car? I suspect that you probably would put in high premium gas because you'd want that car to run well and you would want it to last long because they're pretty expensive. So I have another question for you. You are a unique individual, a valuable, important, unique individual. What do you fuel yourself with? What do you put inside of your machine, your body? Do you put in high quality foods, products, or do you put in processed foods? Not so great. What type of result would we expect to get if we're putting into ourselves those things that are not the best for us? And not just physically. What are we putting inside here? You know, what do we read? What do we see? What do we watch on television? Or what do we listen to, you know, music-wise? You know, is it positive? Is it uplifting? Does it reinforce our positive views of ourselves? It's important what we put in, because what we put in, we will absolutely get out. So just a couple of definitions for our session today, so that when I say health, you have an idea of what I'm talking about. Health, and I did get these definitions from the World Health Organization. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity or illness. Well-being is a state of being happy, healthy, and or prosperous. Two more definitions. Health promotion and preventive health care. Health promotion is a process of enabling people to increase control over and improve their health. And preventive health care, the goal is to reduce the risk of disease, disability, and death. And so when you think about your last visit to your medical health provider, your mental health provider, your dentist, your eye doctor, did you have a discussion about health? Have you ever had a discussion about health and health prevention? Do you have conversations around, you know, what things can I do to promote better health? Just something to think about. So as I said, and as you saw on the slides, health encompasses quite a bit. And in this slide, you'll see, you know, it focuses on emotional, mental, physical. But as I stated, it also includes spiritual. It includes social. It includes financial. And so there are many more circles, but we are not just physical. And so when we think about health and we think about health promotion and taking charge of that, what are some things that can I do around my physical health, my mental health, my emotional health? So I want to say to you, you know, there's not much I'm going to say today that you probably haven't heard. But what I'm hoping to encourage us with is, with this information that we have, what can I do with it? You know, my goal is to encourage you, possibly empower you to act, you know, to improve your health. It's not a passive endeavor. I can't sit back and just be healthy. If I just sit back and do nothing, I absolutely will have decreased health. You know, it takes some intentionality. We must be accountable to our health, and we need community to do it. Some may disagree, but I believe we need community to do it. And we must seek to transform ourselves. And what do I mean? It's not easy to just conform to an idea or to a way of life or to a habit. You tell me, don't eat white rice. Well, why? Why is that good or bad for me? What is that doing to my health? Instead, I want to propose that we transform ourselves. We make a thorough change in the way we think. We rebuild, we alter our mindset in a way where we can take these things that we already know, and we take these things and we apply it in a way that it sticks. It's not a fad. We apply it in a way that sticks. We transform our mindset so that in turn we can transform our physical, our mental, and our emotional well-being. There are some basic things that we need to be healthy. And this slide speaks to those basic needs. Maslow is a theorist, and he came up with the hierarchy of needs. If you look at this picture, you see that it doesn't just say hierarchy of needs. It's hierarchy of inequity. See, for the Black and Brown community, there's a steeper climb to fulfill basic needs. We know this. We actually live it. We experience it. Everyone, regardless of race, ethnicity, gender, we all need basic needs: air, clean water, food, rest, shelter, clothing. We all need those basic things. But we still struggle, we, Black and Brown community, struggle with these basic needs. And those basic needs are important for our health promotion and for our well-being. Individually, we may be able to accomplish those things, but I'd like to propose that collectively, we absolutely can meet those needs. And this slide, this speaks for itself. It's not going to take one diet. It's not going to take 1 month of challenges. We did not get into the health or unhealthy state that we're in overnight. It's not a sprint, but it is a marathon. Slow and steady wins the race. And I'd like to propose that in winning the race, I'm not satisfied if I'm winning by myself. I want someone on my side, on my right side, and on my left side, crossing that line with me. So again, we need to change our mindset when it comes to health promotion about how I can take charge of my own health, and know that it's going to take a little time, but it'll be worth it. And in taking a little bit of time, it's a little bit easier if I have someone alongside me running that marathon. I have some company. So how do we promote health? How do we prevent illness? How can I make a change in my health? I've heard all this stuff before. What makes this different? I know what I'm supposed to do. Is this hour really worth my while? What am I going to come out of this with? I want to propose that the how is being accountable. The how is being in community. And the how is in transforming. So you see the me, that's me in the middle. But that's also you in the middle. That's all the me's that are on this webinar today. We're there in the middle, and we're affected by our accountability, our community, and whether we choose to transform ourselves. So what's accountability? Well, think about this. Have you ever had a goal for anything and you didn't share it? Well, you might have met that goal. You may not have met that goal. Secret goals, as my daughter would put it, it's no bueno. Secret goals are easy to kind of put aside and even make believe they never existed. But if I tell my mom or my coworker or a friend, hey, you know what? I'm really trying to drink more water because I really need to. It's something that I'm trying to do for my health. When they see me, they're going to say, Melissa, you've been drinking your water? See, accountability is sharing, in this instance, sharing your health definition, your health goal with someone who you can trust, someone who will not shame you, because this is not about shame. This is not about judgment. You know what you should be doing. You shouldn't be doing this and you shouldn't be doing that. But rather, what it is, hey, I'm working on this goal, and I'd love for you to help me out simply by helping me be accountable to it. Encouraging me when I'm too tired to take a walk, encouraging me when I pick up the soda instead of the water. Partnering with someone oftentimes, not 100%, but oftentimes makes reaching that goal a little bit easier, a little bit easier. So I suggest that we begin to use that as a tool. There's one place that, one framework that uses accountability, and that's AA, 90 meetings in 90 days. And there's something behind that. The individual who needs that support goes every single day without fail. And they're there in the midst of other individuals who have similar needs or similar challenges. And they encourage one another. There's no condemnation. There's no shame. There's just building up and supporting, and there's understanding. So I propose that we begin to use accountability to help us with health promotion and health prevention. And community. Well, how do we use community? One way is what we're doing today. Crossroads for Help, they have many programs, yoga and art. They have support groups, people coming together with similar needs, similar interests, working together toward a similar goal, not the exact goal, but a similar goal, healing in some way. And in this instance, it would be health promotion. Maybe it might be the people at your church or synagogue, your community center. Hey, let's start walking on Saturdays. The weather's beautiful out. Let's go for a walk. It could be just around the block. So it's not intimidating. And maybe that block turns into 2 blocks and 3 blocks. Maybe it's with your sorority sisters or brother or your fraternity brothers, or maybe it's with just a group with a similar, I'm having some trouble with my hypertension. And I love collard greens with fat back or neck bones. How can I learn to cook that in a way where it's delicious and I can still eat it, but it doesn't affect my blood pressure? It actually helps to lower my blood pressure because collard greens are healthy in and of themselves. And maybe getting together with a group to try recipes on how to make that food delicious and healthy. So community can provide support. It can provide a safe space. And then lastly, transform. I talked about transformation, transforming the mind. Again, we know what we need to do to be healthy for the most part. Why don't we? Like, what is that block? What is that barrier? Why is it so hard to pass by those fast food restaurants? Why is it so hard to stay away from the nighttime Ben and Jerry's? Or why is it that, I don't walk? And I know that my muscles and my joints are achy when I don't move, but I don't move. And so taking the time to really think about what is that block, even to the point of maybe working with a counselor. What gets in my way? Meaning me getting in the way. In other words, I have what I need, but I'm getting in my own way when it comes to my health. What's my self-talk? What am I saying to myself? Am I saying, you know what, Melissa, you can do this? Even if I don't do it every day, no, you can do it. You can do it. Stick with it. Keep with it. Or am I saying, you know what, you always, you never stick to that diet. You never, so what is my self-talk? What about even my history? I talked about family experiences, and what about my childhood maybe? Maybe I have a certain way of thinking about myself because of hurts and traumas from my childhood. How does that play into my adult self today and my health and my decisions? Again, seeking counseling is a healthy thing. Talking through and just figuring out what's going on and why do I have that particular barrier? And so, what are our action items? How can we use this accountability and community and transforming to help ourselves meet those needs? And I want you to think about that for yourself, because I can't answer that for you. I'll be transparent with you. I'm answering that for myself. I'll tell you, this May, my family and I, we're working on a water challenge. I'm going to show you. I've got water. Doesn't matter what brand it is. I've got water. I bring it to work every day. Sometimes I bring the bottle in full. And unfortunately, when I leave at the end of the day, that same bottle is full. What's in my way? Why am I not drinking this water? So I spoke with my mother and my aunt and my siblings, and we are working on a water challenge for the month of May. What's my goal? My goal is to drink an adequate amount of water every day and do it to the point where it just becomes what I do. Just like I brush my teeth every day, I drink water every day. So again, I can't answer it for you. You have to answer it for yourself. So we're going to talk a little about some basic needs. And when I talk about this slide for the next couple of minutes, if there's anything that I touch on that you are having some challenges with, please send that information in the question, because we don't want anyone leaving here today not having a need met that we can help you meet, because we may not have the answer and we may not have the resource, but we may know who has the answer and we may know who has the resource. Again, no shame and no judgment. We're here for each other and we're here to serve each other. So if there's anything that I talk about in the next few minutes and you say, you know what, I'm really having a challenge with that, then please, share that with us. So one of the basic things that we need is we need a clean environment, an environment with clean air, clean neighborhood. And that's not always easy, especially in an urban area. Now I'm talking about air pollution. That's not always easy in an urban area. But as far as the grounds being clean, there's some things that we might be able to do there. I grew up in the projects in Newark. And when I grew up in the 60s and 70s, the neighbors, everyone cleaned their own area. They swept their hallways, they mopped them down, they cleaned up the grounds. It's what the neighbors did. And neighbors still do that today. It varies from neighborhood to neighborhood, but I'm proposing if you're in a neighborhood that isn't clean and safe, maybe you meet someone who's like-minded in that neighborhood or outside of your neighborhood who's willing to come in on a Saturday with gloves and bag and clean up the street. Speak to the local officials and say to them, we want a cleaner neighborhood. Why do we want a cleaner neighborhood? I need a place to walk. I need level sidewalks. I don't want to fall and trip and hurt myself. I don't want to walk in glass and garbage. That's how that relates to our health. And air quality is important because if you have respiratory problems, that can be an issue. That's a little bit more of a challenge, but not impossible. But do you have a safe, clean environment to live in? That's a basic need that everyone should have, and that should be met. It will take community, though, to meet it, because there are some neighborhoods that it will take a bunch of us to get together, like I said, on a Saturday morning with gloves and bag to pick up the neighborhood. We can do it. That's in our power. And as I said, enlist the public officials. Maybe we need garbage cans in our neighborhood so that we can begin to get people in the habit of just take your trash and put it in the garbage can. It can be done. The next thing, do you have a safe, clean place to live and affordable? Affordable housing in New Jersey is challenging. It's really challenging. But do you have a place to live? Is it clean? Is it safe? Are there light bulbs in the stairwell if you happen to live in an apartment building? If you live in a home, do you have proper heating? Do you have proper running water? If you're in say an apartment building, is it free from rodents? Is it free from insects? It should be. That's a basic need. That is something that everyone should be able to live without. And so what can we do about that? What's in our power to do? Because we know, or most of us know on this call, it's been found that the insects can poorly affect our children and cause asthma. So what can we do? Well, maybe we know that there's a landlord who has multiple properties or maybe just one property. And this landlord is someone who we may consider a slumlord. There are guidelines, there are ordinances, there are laws on how a property must be maintained. Maybe I don't know how to write a letter to my congressman or to my local official. Maybe I don't know who to call in Trenton or the local town hall or city hall to say, I'm having these problems, but I might know someone who knows. I might know an agency that can come alongside me and help me. How can we get this information out to ourselves and help each other? How can we call the media, put this landlord on blast, as they say, because it's not okay that we don't have safe and clean housing. It's a basic need and it's needed for health. And so again, how can we get these resources out? How can we educate ourselves? But not only that, if you know how to do it and you see someone in need, that you volunteer and help them do it. Help them write a letter. Help them get the attention that they need so that their home is clean, free of rodents, free of insects, no holes in the walls, lights in the stairwells. Very simple, but definitely needed. And what about sleep? Well, if I don't have a safe and clean apartment, where am I going to sleep? And we do know that there's an issue. Not everyone has housing, but we know that it's needed. And sleep, when you look at this picture, what does good sleep do for us? How is that health promotion? How does that prevent illness? For America, I'll speak for Americans, it's a badge of honor to say, oh, I only need 4 hours of sleep. I don't need much sleep. Well, that's not necessarily a good thing. 7 hours, 8 hours is actually healthy. It helps with attention, with decision-making. It helps with your immune system. It helps with better physical health. It helps you manage stress. It increases your energy. But if you're someone who only sleeps 4 hours a night, you're not going to go to sleeping 7 hours a night. But maybe you might decide, maybe I'll up that to 5 hours. Maybe I'll try it. Maybe I might find that, I do have a little bit more energy during the day. I am a little less stressed. I have been feeling a little bit better. And maybe you'll move from 5 hours a night to maybe 6 hours a night. Small increments, small changes are best because it's easier to follow, easier to stick to. Tell somebody that you're doing it so that you can be accountable. But you're more likely to stick to a small change rather than a bigger change. And here we are with water. Everybody knows water is important. I don't think anyone would disagree. And there are some things that you may or may not be able to do based on your current health situation. I'm not suggesting that you don't do what you and your doctor have. If you came up with a treatment plan, I'm not suggesting that you throw that treatment plan out of the window. Take it and just go back and have a conversation. But if you can drink water, maybe you can't drink as much water, but based on your condition, drink water. I know that soda can be delicious, but it's not very healthy. The sugar isn't healthy, nor is too much juice, even if it's fruit juice. But my question today is, do you have water? Like, do you have access to clean water? I showed a bottle earlier. It's like a given. Everybody has bottled water. But I can remember the day where I just went to the faucet and I turned it on and I just drank the water. The fact that we have to buy water, something's not right with that, but it is what it is right now. But do you have clean water to drink? Are you drinking enough water? I'll suggest to you, if you're only drinking a glass of water a day, maybe up it to 2. Maybe for each Coke that you drink, and remember, Coke is very acidic and toxic, or Pepsi, it doesn't matter which brand. But for every one of those you drink a glass of water. Same for tea and coffee. Do small incremental changes. We're made up of 60% of water. Our body needs it. And there are some calculations out there. Some say drink half your weight in water. Some say drink 8 glasses of water a day. The point is drink water. But you may say, I can't get bottled water. It costs too much at the corner store. I can't get to the grocery store to get those big cases of water where you can get 3 for $10. Maybe you can get a filter for your faucet. There are some townships and some cities that provide filters that you can actually put on your faucet. Or maybe you have access to a filter. That's too, and think about how to apply for a grant so that we can buy filter pictures and give it out to the community so that a family that may not have much money, they don't have to spend their money on water, but instead they can drink water from their faucet, but filter it and be able to have water for themselves, for their family. These are just some ideas, just some thoughts, but water is necessary. And are you drinking enough water? And then there's our food. Firstly, do you have enough food? And I'm not even going to say, do you have enough healthy food? I just want to know, do you have food to eat? I mean, in America, for the most part, we have food, but there are still areas in our country, and maybe here even in our state, where people are going to bed hungry. And that really makes no sense. We have enough food to feed everyone. So if you don't have enough food, there are food banks. And yes, food banks, the foods are processed. They last longer in the food bank, yes. But I mean, getting you food is more important first. And then making it healthier would be the next step. And if you don't have enough food, let us know. Another challenge we have is some of us live in food deserts or food swamps, areas that don't have supermarkets. Supermarkets provide for us more variety, lower prices. And there's nothing wrong with our stores and our bodegas. We need them. But most of the food there, not all, but most of the food there is processed foods, and processed foods are just not healthy for us. Now, understand what I'm saying. Most foods are processed to some degree. And what do I mean by processed? Envision an apple. An apple is a whole food. What ingredient is in an apple? It's apple. But in other foods, they may have more ingredients in it. They may be processed in one way or another, cut or steamed or processed. So processing is not a bad thing. I'm referring to the kinds of foods that can last on your shelf for 50 years. I'm talking about foods that have ingredients in them that you can't pronounce, nor do you know what it is. So that's what I'm referring to when I say processed foods. So can I eat? And the picture shows mostly fruits and vegetables, but what I want you to focus more so on is the rainbow. It's the rainbow. When's the last time you had a purple food or a red food or an orange food? If you find that your food is missing some colors, maybe just pick one color, maybe purple, and add some blueberries to your diet. Or add an eggplant. Well, I don't eat eggplant. Google it, YouTube it. There are so many easy recipes on YouTube for foods. Try it, but expand your palate. In our adult age, if we're not allergic to it, maybe it's time for us to stop saying, I don't like that. I don't eat that. Maybe try a new food and try making it in a way that is palatable for you. And maybe eat the food because you know it's going to provide the healthy nutrition that your precious machine needs. It's going to provide vitamins and minerals and trace minerals that you need. We can't expect our bodies to keep going and going and going, or even our minds thinking clearly. Our emotions not being, all over the place. If we're not willing to do our part in putting in good stuff, good foods. When it comes to fruits and vegetables, it can be challenging to buy fresh, but that's okay. Frozen is good as well. Think about it. Fruits and vegetables that are frozen are picked at its peak, at the peak of freshness, and then frozen. And frozen lasts longer in our freezers. Sometimes, fresh fruit or vegetables, if we wait too long, they spoil on the counter. And now we've wasted food and we've wasted money. So go frozen. It's better than canned. And maybe not the best as fresh, but it's the next best thing. And again, when you're thinking about your foods, try eating the rainbow. Try expanding the colors. One other thing I'd like to share or even suggest, let's start eating without our phones. Many of us, if not all of us, we don't go anywhere without this. We don't go anywhere. Some of us even go to the bathroom with our phones. Maybe try putting your phone to the side when you're eating your meal and really think about, what am I eating? Be thoughtful and mindful about what you're putting in your mouth. That's something that is within your power to do. Start cooking at home. If you're not a good cook, like I said, YouTube has some great videos. Start small. If you're very busy, maybe a single parent, try food prepping. What's food prepping? Well, it's preparing several meals in one day that can last for the week. Might save you some time and save you some money. And two other things I want to mention about the food. One is meal planning. Meal planning is great. It saves loads of money. You plan your meals. You think about, what is my family or what am I going to have for the week? When you go to the supermarket, you have your grocery list so you don't go hungry. Make sure you have a snack before you go. But you go and you shop your list. You know what your meals are. So when you're done at the end of the day and you're so tired and you just want to go home and lay down, oh, I've got all my groceries. I know exactly what I'm going to eat. I've either already prepped it or I planned it. So I'm not stopping at Chipotle. I'm not stopping at Chick-fil-A. I'm not stopping at McDonald's. I'm not ordering pizza. And there's nothing wrong per se with those things. But when that's our norm, it impacts our wallet and it impacts our bodies and it impacts our minds, and not in a positive way. And so lastly, with this slide is clothing. Do we have the clothing that we need? Do you have what you need? Well, there's some resources. There are clothing banks and there are thrift stores that are actually pretty good. But clothing's important. Why? We need to dress for the weather. We need to dress appropriately. It goes without saying, in New Jersey, it could be freezing in the winter. And you want to make sure that you have the proper clothing. Does your neighbor have the proper clothing? Do you notice? I work in an office, in a physician practice. We pay attention to our families when they're coming in the winter particularly. Do the children have hat and gloves? Do the adults have coats? The staff here, they bring in things that are gently used, that they don't use and they don't need. And we put it out and it's for the patients to take it if they like. We also share our books too, which is an aside, but we also share our books and we just put it out there for them to take if they like. I propose that we, meaning everyone on this line, probably has more than enough clothes in their closet. Things that they bought and you just knew you were going to wear them, but you never got around to wearing them. And some have tags on. And I'll just be transparent. I'm talking to myself. I've got clothes in my closet I've had for years and they still have tags on it. So I'm working on cleaning out my closet and giving those things away. You can have a garage sale or you can just give them away. But there are people in our community, our neighbors. And when I say neighbor, not necessarily the person who lives right next door to you. Maybe there's a person who's a town over from you, who they are in need. We can go into our closets and our cupboards and clean them out of things that we don't use or need and give them to our extended family, I'm going to say, to our community. We can help and provide what's needed for our own community. And these are things that we need to be healthy. These are things that we need to promote health. And so I know that this phrase is used when we talk about children, but I really think it has to do with health as well. Yes, we deal with health disparities. It's a high burden of illness in our communities. Some of it can be prevented. Some of it, not all of it, but some of it can be prevented. It's got to start with me. I've got to work on myself because I have 4 children who I want to be an example for. And I have 4 grandchildren who I want to grow up healthy. It's a little easier to hold on to your health than it is to recover from an illness. But it's going to take all of us. It's going to take us on this call. How can we help each other? What's one thing that you're going to change? Just one thing that you're going to change today or tomorrow that's going to help you be healthier. And how can we partner together to make that happen? How can we in this state work together to have a healthier New Jersey? You may not know, but we are very high on the list for maternal mortality. That's moms dying in childbirth and a year after giving birth. In 2021, there's no reason for that. How can we work together with those things in our community that we have burdens with? The burden of hypertension, high blood pressure, the burden of diabetes, the burden of overweight and obesity. It's multifaceted. It's not as simple as just eat right, just drink water. Again, you've got to transform your mind. It's got to be a change in mindset. But how can we do that together? How can we ease the burden? Because there's just so much stress day to day. But I believe that we have the resources and we have what we need to make it happen.